Hello, my name is Dr. Kristin Rushing, and today I would like to talk with you about implant dentistry and using CT guided imaging for replacing missing teeth. So previously we had discussed the use of dental implants, and just to recap on that, dental implants can be used to replace a single missing tooth. Multiple implants can support a dental bridge, or they can be used to stabilize or retain a partial or denture that replaces all the teeth in an arch. Dental implant components consist of the crown, which looks like the tooth, an abutment screw, abutment, and implant. You can see those referenced in the diagram. The abutment sits into the implant, and the abutment screw goes into a channel and connects the two. The crown is then cemented on top. So why use CT guidance for implant placement? And there can be several reasons. If you are planning for multiple implants in a row and would like for them to be perfectly parallel, it can evaluate the proximity to vital anatomy and therefore can increase your margin of safety. If there are problems with proximity to adjacent teeth, if the teeth are slightly convergent, if they're angled towards one another, it can help you avoid adjacent roots. If there's questionable bone volume, meaning if there's a deficiency in the width or height, or any unusual bony contours. Implant position that is critical to the restoration. Especially in anterior or front teeth, you want it to be lined up exactly as symmetrical with the neighbors so that everything looks aesthetic. It can also allow for flapless implant surgery. Without CT guidance, you typically have to make a larger incision so that you can identify any bony contours or bone deficiencies so that you can see exactly where the bone is and where it isn't during your implant placement. Having a CT scan, you can visualize that before the surgery even begins. Here is a case study that can show some of the reasons why CT guidance is beneficial. In this particular patient, this is a patient of mine that presented with one tooth that had been extracted some years ago and one cracked tooth that needed extraction. So here is where the one tooth was previously extracted, and obviously here is our cracked tooth. So we discussed replacement options, and those included a removable partial denture or dental implants. The patient wished to proceed with dental implants. In this particular case, we plan to extract this single tooth and bone graft this socket. As you can see, with the crack, there was a lot of bone loss in that area. So instead of compromising our future implant, we decided it was best to do a delayed placement and let this heal prior to beginning. So factors affecting treatment. This particular patient was a type 2 diabetic, and that can delay your healing. With the cracked root in place, that could cause, and in this case it did cause, some significant bone loss in that area. We planned on extracting the tooth and perform a socket graft. This was a CT image after the healing had taken place, and we were planning for 2 dental implants. Now, in this image, you can see we wanted the implants to be parallel with one another, and we also wanted to avoid the nerve that runs in the lower jaw. Here, it's highlighted in green. In the previous slide, while it's not highlighted, you can still see it outlined here. So, using the CT, again, we're able to guarantee that our implants are parallel. We're able to avoid any issues with the adjacent tooth in front, as well as avoid the nerve that's in the lower jaw. This lets us see the 3 dimensions that the CT scan allows us. It allows for easy identification of the nerve that we spoke about before. Here it is still highlighted in green. And any unusual bony contours. If you look at the jaw at the top of the ridge, it looks certainly wider, but as you go down towards where the nerve is, you can see that it narrows. That can be misleading when you're looking just in the mouth. So the CT allows for precise placement of the dental implants within the bone with a wider margin of safety. For this case, we wanted parallel implants with ample depth that were also well away from the inferior alveolar nerve. Now, how does that translate to the mouth and during the surgery? That's through a surgical guide. Once the orientation of the implants are mapped from the CT scan, it's translated into the mouth via a surgical guide. The guide controls the angle as well as the depth of the implants. Here, the surgical guide is shown on a stone model as well as in the mouth. Here we are after placement. The x-ray is on the day of placement. You can see that the implants are nice and level with the bony ridge. This is the area where we had the bone graft previously and where we had a lot of bone deterioration from the cracked root. That's filled in nicely, but you can still see there's a little bit of dip in the bone from where the adjacent teeth were. Now, the implants were allowed to integrate for 6 months prior to uncovery, and that was because this patient was a diabetic. The image on the left, you can see this is during the healing phase, so you can't see the implants, but they're in there. When we uncover the implants, the gums are allowed to heal around a healing collar. That's what you see in the top image. The healing collars are temporarily replaced with special posts for the purpose of our impression, and that's the image on the lower. Final crowns. In this case, it was decided to use screw-retained crowns. Screw-retained crowns are easily removed if needed, and the absence of cement eliminates any gingival irritation. So just like there was a channel that the abutment screw went through, the abutment and the crown are made in one unit, and the abutment screw goes through the crown and screws the crown down into the implant. Once that has been seated fully, the access is closed with a tooth-colored composite. Now, I don't always do screw-retained crowns, but in this particular case, we were looking at back teeth, and that's typically not very noticeable for back teeth. And in case there was ever an issue where we needed to take the crowns off, we're certainly in a position where it's much easier to do that. So here is our before and after. And this is where, again, we've already extracted the compromised tooth and have bone grafted in that area. And after with our 2 implants and our 2 crowns. Thank you for joining me for a discussion of replacing missing teeth with CT-guided implants. I hope you've enjoyed this presentation and it was of some benefit for you. Thank you.